So hello everyone and welcome to this CCA webinar on sound sensitivity. We've called this webinar Stop Your Dog from Barking at Noises, and I'm really excited to be talking about this topic today because it's probably one of the ones that's closest to my heart, my own dog being sound sensitive. I'm gonna get us started today just like looking at like what the sort of problem might be, I guess, or where you might be now. Lots of people come into our programs or into our webinars in a kind of panic point, often quite stressed out. And that's because having a dog that barks at every sound that they hear, or if they're struggling to relax in their home or hypervigilant, this can be really, really challenging. It can be a real damaging factor to your relationship. And if you are in this position, you're in the right place. We're going to be talking today about sound sensitivity. The first half of our webinar is going to be about understanding sound sensitivity. And then the second half will be going into the healing process and how we can facilitate change for these dogs. Before I dive into all of the nitty-gritty about sound sensitivity, it's probably good to just introduce myself a little bit. First of all, let me introduce the group that I'm a part of. We are called Canine Academy. We are a collective of internationally recognized dog trainers and behavior consultants, and we specialize in supporting sensitive dogs and their exceptional guardians. We do all of our work 100% virtually, and we facilitate healing in both species through our innovative coaching programs. And it's really exciting to be here. We can share some of that with you today. Myself, my name is Karishma Warr. I work as head of training and behavior at Canine Academy and also founder. My pronouns are they, them, and I'm a multi-certified dog trainer. I have a master's degree in ethics. I'm a certified professional dog trainer, knowledge assessed. I am a certified separation anxiety trainer, and I've been working for the last 7 years, deeply immersed in my work helping dogs that struggle with anxious, reactive, or aggressive behaviors. At this point, we've worked with dogs in over 15 countries, and we're really excited to be hosting this as part of Canine Academy's mission, which is to create and put out functional and accessible resources for dog guardians and our amazing community. So thank you so much for being here. Hopefully we'll all learn something today. And just really grateful for you all showing up for your dogs and learning. It's always going to be making us better and better guardians and caretakers to them. So that's a little bit about me. Let's skip now to the juicy bits and start talking about sound sensitivity. Understanding sound sensitivity is going to be the first thing on our list. We're going to spend a little time chatting about this because without understanding why our dogs are performing these behaviors, we're never going to be able to actually come up with a functional, holistic behavior change program and facilitate healing. So let's start with the basics. What is sound sensitivity is the first question on the list. Well, it kind of makes sense, the title of this webinar, Stop Your Dog Barking at Noises, right? Sound sensitivity generally is like an overreaction to everyday noises. So the triggers are noises, sounds. We call that in fancy behavior language the antecedent, the thing that happens that triggers the behavior. I want to know from you folks who are live here today, pop in the chat, what sounds trigger your dogs? And I'm going to read some of them out because it's often a wide variety of different noises. And I'll talk a little bit more about that in a minute. When dogs hear these noises, they often tend to have a kind of fight, flight, freeze, fawn, fidget type response, which essentially is like a panic response. In many cases, of course, every animal is different. I'm talking in generalizations here, and please, take it with a pinch of salt because behavior is super complicated. But the majority of the time when I'm working with these sound sensitive dogs, the function of the behavior is a sort of fear response, trying to seek safety, alert humans to danger, do their job to keep them safe kind of vibe. Hardly my most scientific description of behavior, but it makes sense when you think about the sort of triggers that we're dealing with here. So let's read some people's triggers. People walking down the staircase, we've got a lot of that. People talking, noises in the backyard, barking dogs. These things are all indicative of a fear usually, or a need to alert to something in the environment, usually to keep themselves safe, right? They're not just being jerks. There's a reason that they're doing this. And we always ask, WTF, what's the function? And I tend to find that for lots of these dogs, they bark at something scary, the thing goes away, no big boogeyman comes and eats them, and they go, nailed it. Okay, this is how I keep myself safe. So think a little bit about the function of your dog's behavior. We'll talk more about that in a moment. And this safety seeking becomes all the more obvious when we notice that often sound sensitive dogs have other behavior challenges and sensitivities. If you're in here live, let me know. Do your dogs have other sensitivities, maybe to strangers or dogs? Maybe environmentally they're a little bit sensitive, or they have a fear of being handled or groomed. Separation anxiety, yes. Reactivity, here we go. Yes, I'm getting so many messages in the chat. Strangers and dogs, exactly. So sometimes we have dogs who are sensitive to noises because they indicate that there is something else in the environment that's unsafe, and they have this kind of wider, more complex anxiety, fear, mental health situation going on. Now, like I say, behavior is super complex. Take what I'm saying with a pinch of salt. But in general, when we're talking as a group at Calm Canine Academy, we see two very distinct presentations of sound sensitive behaviors in dogs. One is dogs that are triggered by specific noises. So often these noises are linked to a stimulus that they already have big feelings about. So for example, we've got people in the chat here saying that their dog's really nervous about noises in the hallway, and they are stranger fearful and stranger reactive. Okay, so that makes sense, right? They are triggered by specific noises because they have learned that those noises lead to something that they consider to be unsafe, or maybe even just really exciting. But often at CCA, if you're here, likely we're dealing with a feeling of fear underlying, or at least conflict to some degree. So let's think about some examples: the doorbell, dogs barking, footsteps, voices, etc. like that. That's the sort of stuff that would be under this specific noise presentation. Other dogs are triggered by all noises. It's almost like a generalized fear and phobia of sound. People will come to us saying, I just click my pen and my dog startles. I put my cup down and my dog startles. A clicking noise, a high-pitched noise, any noise, they are so triggered. I want to hear if anyone is here who has had that experience. Here we have a whole bunch of folks now saying that's kind of been my experience, and you might experience both at the same time, but it's useful to think about the difference. Thinking about that difference will impact how the treatment plan plays out. So it's something to think about, and it's something that if you were to take like one of our programs, we would dive into a lot more depth around this. But for now, it's useful to just think about the fact that we often see these two kind of presentations. There's like a Venn diagram, they intersect, but there is often two kind of ways that it presents. Now, the next thing that I think we need to think about is the why. We've talked a little bit about the whys in terms of the function of the behavior, but I guess the question folks often have for me and for us at CCA is, why my dog? Like, why is it that my dog is so sensitive to these things and other dogs are not sensitive to these things? And it's a really good question. It's a complicated question. I don't have time to go into the amount of depth I'd like, but what I'm going to do is I'm going to overview it for you, and I'm going to use this framework that we use at Calm Canine Academy. It's called the HEAL framework for behavior change and wellness, and it's kind of like the 4 areas of behavioral health. We use it to understand behavior, discuss behavior, and create training plans. It's much more complicated than I can explain in this webinar because we're focusing on sound. But as we go through this webinar, you will see links to deep dives on certain subjects. If you're nerdy like me, you might want more. So you'll always be able to go there. So as you'll see, we're going to talk about why dogs are sound sensitive. And you can always, when you get the resources here, you can click here and you can see the kind of further resources we have in these different areas if you're interested. So why is it that my poodle Hera is super sound sensitive, but my parents' Shih Tzu Obi is less sound sensitive? Why is that? It's not simple. There are 4 areas that we'll look to explain this. The first being health, the health and the medical status of the animal. So we're looking at medical issues, anxiety, untreated trauma, and genetic predisposition. So certain breeds might be more likely to experience sound sensitivity than others. The health area is really important in the treatment plan. We'll talk about that in a minute, but it's also important in just understanding your dog's behavior, because if you have a hunting dog who is fearful of people and has had some trauma with people coming into the home, it kind of makes sense, if you know what, as I do, that hunting dogs are predisposed to sound sensitivity. It kind of makes sense that they might be exhibiting maladaptive barking behaviors, too much barking, struggling to calm down. Exposure and how much they're exposed to noises and other things that stress them out is also going to be a really important factor. So if we have a dog that's in a busy urban environment living in an apartment building, they might be in a constant state of hypervigilance, and they might also be overexposed to other triggers like people and dogs and etc. And someone mentioned in the chat that when their dog is trigger stacked, they become really generally anxious about all noises. And trigger stacking, meaning the small buildup of stress throughout the day and an overexposure to stress, can lead to increased sound sensitivity. So you might be looking and ticking some of these off, and that's can be overwhelming sometimes, but also good to just lay it out and be like, okay, this is what's going on. Activity, the activity schedule of your dog, whether we're meeting their needs, whether they're getting rest, whether they're getting the right amount of stimulation, affect sound sensitivity. If my dog Hera doesn't get out to the parks to sniff and roll in nature every other day, he becomes a sound monster. That's Hera right there. My little poodle. An inappropriate activity schedule where I'm playing lots of fetch with him and he's going for long walks in the city increase his sound sensitivity. So you can see how this might be, we're going to be looking at all of these different areas for treatment, and we're going to be looking at all of these different areas when understanding why our dog might be experiencing this. Now, finally, learning. So we've discussed traumatic experiences. I think as well, we might just get dogs rehearsing the behavior a lot, right? Because it's so hard to manage in the home, isn't it? When the noises are coming from everywhere. So we might just see dogs who are barking a lot throughout the day. And that usually leads to them learning that that's how they meet their need. You know, if your dog's in their house and 10 times a day there are noises in the hallway and they bark, and then the noises go away 10 times a day, reaffirming that lesson for your animal that this is how they keep themselves safe, this is how they protect their space, etc., etc. And it can become almost like this superstitious thing. They feel like they need to do it to keep themselves safe. And then also, lastly, we might see a history of punishment. So we might see dogs who have been, maybe guardians were given recommendations to correct the dog after they bark, or maybe guardians have lost their temper, like I have many times, no judgment, and just gone, shut up. And maybe that triggered the dog. If your dog is sensitive, that can be enough to be a punishment. So basically, sometimes humans will apply even more stress after the dog barks, and that can actually make, ultimately in the long run, their sound sensitivity worse. Actually, someone's got a really good point in the chat here, which is multi-dog households. So another learning that they might have experienced is socially facilitated learning. What a great point. I didn't even have it in my slideshow. 10 points to the people in the chat who are keeping me straight and filling in the gaps, because socially facilitated learning is a great example of another way that your dogs might have learned that barking is the thing that they should be doing. You might be already getting this idea, but the biggest threat to sound sensitive dogs is the chronic stress cycle. It's hard to manage your dog's exposure to noises sometimes in the home, especially if your dog is very, very, very sensitive. And we find time and time again our dogs getting into this cycle. My own dog Hero was in this cycle, the poodle that you just saw, where we were living on the ground floor of a busy urban like apartment building, and every time people came in through the front door, he would panic. And he would panic for about 2 minutes, and then I'd manage to calm him down. But he would react to the triggers and then develop hypervigilance to these triggers. Because of that, I was really unable to meet his needs. I was struggling to get him enough sleep throughout the day. You know, dogs need like 16 hours of sleep throughout the day to be healthy. I was unable to meet his needs for exercise because he was sensitive to noises on the street too, like car engines and stuff like that, and environmental sounds. And because of that, because of the lack of sleep, because he wasn't getting out in nature, he exhibited decreased regulation. He got more sensitive to the triggers, and the cycle starts again. And it was getting worse and worse and worse and worse for us, honestly. At his worst, he was barking more than 50 times a day, having meltdowns, and really, really struggling to calm himself down. And it was really, really challenging for me. Living with sensitive dogs can be really, really challenging, especially if you're stuck in that cycle with your dogs. It can be a financial drain. It can be an energy drain on our energetic resources. They often have high needs. It's like a balancing act. It feels like spinning many plates. But as someone who's kind of significantly gone through this healing process with my own dogs and continue to with the new dogs in my home, our dogs have this amazing capacity for healing, just like we do, when we provide functional and holistic treatment plans. And that's what we're going to talk about for the next like 25 minutes or so. We're going to be chatting about the plan. Now we have some idea of what sound sensitivity is, the sort of things that are going to impact a dog becoming more sound sensitive and maybe entering this chronic stress cycle. We're going to be kind of looking at now the path forward. And it sounds like everyone who's giving me like details about their dogs, you're absolutely in the right place. It all makes a lot of sense within the framework that we're discussing, and that's actually a really good thing, because it means that we have a path forward. And let's dive into that a little bit and talk about healing sensitive dogs. So we say healing, not training, because to be perfectly honest, we're not training them to do behaviors. We're not training them like you would train an obedience dog or an agility dog. We are doing integrative mental health work. It's healing, and we use our HEAL framework to construct these behavior plans, multimodal behavior plans that span across the 4 quadrants. Now, people always ask me, like, how do I respond in the moment? How should I train my dog not to bark at noises? That's not really the right question. We need to be thinking integratively. And I'm going to be going into today, not the whole plan. It's impossible. I'm going to be doing a kind of like whistle stop tour so that you can maybe get some idea of the journey that you would be on if you joined us for one of our coaching programs, or if you just kind of take this information and go off on your own with it. And it all starts, honestly, with breaking the stress cycle. If there's anything that you can do right now, immediately, it is put interventions in place that break the stress cycle. So we remember that stress cycle starts with our dogs having reactions and developing hypervigilance. So we need to start to manage their environment and manage their exposure to triggers. So here are just some strategies that we use. White noise machines, sometimes layered. So a white noise machine plus a radio plus another pink noise. Sometimes that's what we need. And we often have to use multiple of these. So white noise, window film, something that goes up on the windows if your dog's like hypervigilant to noises and sights. We might put that on the windows. You can just type that in to Amazon and you'll find it. It's very cheap and it comes easily on and off. We might be doing confinement conditioning. I did all of these 3 things with Hero when we were living in Brooklyn. We used multiple white noises and sound masking. I put window film on all the windows, and I taught him to be comfortable in a crate. And then he would be in his crate in the back of the house for multiple hours intermittently throughout the day so that he could sleep, because otherwise he wouldn't sleep. So these strategies were being used to break that stress cycle, to cut it off so it couldn't keep continuing. For dogs whose sound sensitivity extends to outside of the home, or if it extends to other triggers like dogs and people, we might be minimizing walks, we might be avoiding dogs and people. And for more information about this, I would suggest looking at our managing reactivity webinar. So this is over an hour-long webinar all about managing reactivity. So we go into some of these as well as other strategies, and it's a little bit more of a deep dive. But when people say to me, like, what's the best thing I can do for my sound sensitive dog? Often just going in with some stress management strategies is one of the best ways to start to break the cycle of exposure to triggers, start to facilitate that rest that they need. And it's going to be the first thing that we're going to be doing with you. If you worked with us, that's going to be our first step. So it will be worth getting a head start on that. You can find this in our webinar library or click through the slideshow when you get it sent out to you. So we're really thinking integratively. We're thinking about multimodal treatment plans, and we're starting off with breaking that stress cycle first and foremost. For many dogs, it's not enough to put some white noise on. It's not, and maybe they can't tolerate confinement right now. Maybe they live in the middle of a city, so it's really hard to avoid dogs and people. What are we going to do in these cases? And I'm going to be telling every single person here that every single dog that's significantly sound sensitive, meaning that you sought out a webinar and joined to watch it, we need to be checking them with a veterinarian or a veterinary behaviorist. So a veterinary behaviorist is kind of like a doggy psychiatrist. And if we're seeing multiple behavior issues like sound sensitivity, fear of humans, fear of dogs, fear of grooming, you'll need to be looking into that veterinary behaviorist over a veterinarian who is more just like your general practicing medical practitioner. We might want a specialist if we're seeing multiple phobias, right? So look into that, because so many dogs that struggle with sound sensitivity end up in these chronic stress cycles, especially if they're in the city. And I think that there is a significant cultural bias against seeking out anxiety medication. This bias extends even sometimes to the medical professionals. And that's why a veterinary behaviorist is my favorite person to talk to, because they're the specialists in this area. But mental health is a challenging place to get good medical care for humans, so you can imagine that it's similar for dogs. What I'm going to say is that in general, when we have clients working with us, we will never ever recommend medications, but we will always counsel them to speak to a medical professional and then facilitate that conversation from the behavior standpoint. Some flags that we are often looking at or like searching for when considering whether or not we should be bringing an animal to a veterinarian: if your dog's not sleeping that 16 hours a day, if they go from 0 to 100, if they struggle to calm down afterwards. So Emily, for example, one of our dogs in the house, before she was on her medications, she would react to a noise and then just be panting for a really, really, really long time afterwards, like just panting. And that's not normal. That sign of physiological stress maintaining for significant periods of time, that's a lot of stress to put on the body. And there are significant studies out that will show the effects of long-term stress on the body. It's not great, it's gnarly. So multiple fears or phobias, generalized phobias of all noises. I'm taking that dog straight to a vet to discuss anxiety management. Storms or firework phobia, often straight to the vet, because it's really hard to manage and predict. So we often need a little extra help in managing their stress. And if you're just finding that cycle, that stress cycle happening, and you can't do anything to manage the exposure, or even just you're already trying and finding it really hard, these are kind of the things that make me think about talking to clients about going to the vet. And sometimes we have to go to multiple vets, get a second opinion, etc. A few people in the chat asking about the age that it's appropriate to do this at, and I think that's a good question, so I'm going to answer it now. How young is too young? Well, I'm not a veterinarian, so I cannot tell you from a medical standpoint how young is too young, and no dog trainer can. From a behavioral standpoint, because I am a behavior specialist, I am not worried about a young dog starting medication as much as I am worried about a young dog exhibiting and rehearsing maladaptive fear during this formative period. So the first 4 years of an animal's life, they are in their most juicy and potent. They are often sensitive. They often have significant, their experiences in this period often have significant impact. The risks of not addressing significant fear at this age can be really, really dire for their mental health, and then from their welfare and all sorts of things as a knockoff effect. So for me, I'm always trying to give a varied, honest opinion that for me, often I'm saying, if I'm unsure, I'm going to take you to a veterinary behaviorist who is the absolute specialist in this, and we're going to see what they say. And they might give us information about potential risks, etc. But from what I am aware, it's not something that stops me from just pursuing that conversation with a vet, because the effects of long-term stress are also extremely well documented. And we want to avoid that at all costs, from my experience. So some further learning in this area, when training is not enough, is a little like 40-minute chat I have specifically about when, as a dog trainer, I start to think about anxiety meds, and it goes into kind of the different types of anxiety meds that we often use in conjunction with a training and behavior plan, obviously from a behavior perspective, not from a medical perspective. But definitely worth checking that out. All right. So we've talked a little bit about the kind of multimodal approach we have to take to healing sound sensitivity, and how we might start to break that stress cycle by managing their exposure to triggers. For dogs who have complex anxiety and whose environment is challenging, we have to consider going to a veterinarian or a veterinary behaviorist to consider stress management. But there's another big part of the kind of piece of the puzzle here, big piece of the puzzle here, that we need to be thinking about at the beginning of a treatment protocol or a healing protocol. And that's health complications. So I mentioned earlier that often there are underlying undiagnosed medical factors that come into play when we're dealing with sound sensitive dogs. There is a huge correlation between sound sensitivity and health complications. So from my experience, dogs who are sound sensitive are highly likely to have undiagnosed medical issues, and that gets more and more confidently asserted for me the more behavior conditions that they're struggling with. It's so important, because we've worked with hundreds and hundreds of dogs, and they've been working with their guardians on training and obedience for years and gotten nowhere because they're missing this piece of the puzzle. When we do investigations, when we treat the medical issue, we often see it's almost like a piece of the puzzle clicks into place, and it's complex. There are many pieces, but this is a very important piece. And Heidi, who took our Stranger Danger program with Barney, who is fearful of strangers, is writing saying, ever since we healed underlying medical issues, Barney has gotten so much better in all aspects. And this is so true. Now, medical investigations will be an integral part of the process. We will be looking at things like pain and investigations into chronic pain, gait analysis, blood work, urine, scans, all sorts of different things. And as a behavior specialist, our trainers specialize in the behavioral side of medical issues. So we actually really do specialize in working with disabled dogs and dogs who are struggling with medical issues. So our job is to look at your dog and look at their behavior, and then like detectives, pick out what could be going wrong and then maybe guide you. We should go to the vet and give them this information, and we'll take these videos of the way your dog moves, and we'll give them this report of your dog's stool, etc., etc. So often our job is like this, part of our job within the healing plan for sound sensitivity involves medical investigations, and many folks who are in our programs, that health component is one of the primary components that we're working on, because as Heidi so well put so well, when we work in that work to heal that underlying medical issue, so many other issues will immediately go away. And it's, why would we not just go to the root of the problem, right? How we approach investigating underlying health issues with a veterinarian, it really depends on the vet, but often it involves, if you're working with us anyway, what we usually do is we'll send you to the vet with a letter from us, which overviews our observations and kind of asks for collaboration, offers collaboration, and we take it from there. If we find that we're not getting the response, the help that we need, we often will get second opinions or elevate up the ladder to a veterinary behaviorist if necessary. But often it involves, like with many things to do with healthcare, you know, sometimes we have to advocate and come in with a plan and help our healthcare practitioners by making it really easy for them to access the information they need in a simple way, so that they can then make quick decisions and have all the information available. So we try to just make it as accessible for the vets as possible, give them the information they need, and then, you know, we can coach you through the process. If we feel like we might need to get a second opinion, we can make that decision together. If we need to call up the vet and have a little chat, we can do that. It really depends. But often it's helpful to have a guide, like an advocate, when you're navigating any medical industrial complex. So that's often something that we do. And if you want to learn more about this, obviously we're not veterinarians, but we have a free webinar in our webinar library called Pain and Behavior, and it's co-hosted by Dr. Rendon, who is the head of veterinary medicine at the Williamsburg Veterinary Clinic. She's amazing. She has a special interest in behavior medicine. So we talk a lot about how pain impacts behavior, and she gives her opinion from a medical standpoint. It's really, really interesting. So feel free to go and check that out. It's completely free and it's just really juicy. So if you're kind of thinking with your dog, where would I even start? I don't even know where to begin. Kind of what systems should I be investigating? That's kind of a nice place to just check out and like feel around. Someone's mentioning that their labs have been normal and exam has been normal. Now, this is something that I would highly recommend you watch the Pain and Behavior webinar about, because so frequently we find initial investigations yield nothing, but that doesn't necessarily mean there's nothing wrong. It usually means that we're asking the wrong questions. And this is a challenge, but one that we are well versed in working through. So sometimes it involves advocacy, sometimes it involves taking initiative and moving that process forward ourselves to some degree, but do check out the Pain and Behavior webinar, because it answers a lot of these questions in more depth than I'm going to be able to do today. We can maybe come back to it in Q&A later if anyone has any further questions. But remembering that with all of this discussion around health and medical care, we are not veterinarians, we are not medical professionals, we cannot give you medical advice. I mean, I can't give you any advice in a free webinar. Ethically, that would be super dodgy, but we especially can't give you any medical advice because we have no idea. And you can never do this without consulting and collaborating with the veterinarian. So a big part of our work is often finding a good relationship and cultivating a good relationship with a veterinarian who's going to be able to provide the care that we need to move forward with our dogs. All right, folks. So I'm just kind of going to finish up talking about other sound sensitivity therapies, because what I've talked about so far is the kind of foundational stuff, the stuff at the base of the pyramid. We're going to be looking at managing their exposure, medication, looking at other other health complications. There's so many other things that go into this. I just always want to start at the beginning. So we went into depth about the foundational stuff. Let's have a little look at other sound sensitivity therapies, pardon me, that we use alongside these foundational pieces. Now, every dog is totally different, so it really depends on the dog which pieces of the puzzle we put together. One of our trainers, Nikita, says that every dog, building a training plan for a dog is kind of like making a cocktail. Like every dog will have a little dash of this, a little sprinkle of that, like one shot of this, shake it up. And it's going to be different for every dog. Our training plans at CCA aim to be the simplest and most effective, because it's hard enough living in 2023, let alone having to do your therapy and your dog's therapy. So you won't have to do all of these things, but it is something that we often touch upon all of these in our program. So let's go through them a little bit. The Thank You for Barking protocol by Kiki Yablon is one of my favorite things to teach clients who have sound sensitive dogs. It essentially involves reinforcing your dog for low level barking. So if your dog alerts or woof a noise, you can say thank you, and then you can scatter food on the floor for them to eat. This is a very dumbed down version of this protocol. I'll link it for you in the slides so that you can see Kiki's original, well fleshed out version. But in essence, that's what's happening. The dogs are having a little buff. Buff is what I say. I have like different words for different barks. Buff is what I mean when dogs go like boof. You know that bark? It's like a very specific bark, like a low level bark. If they have like a low level alert or even a full blown response, we don't punish them, we don't correct them, we don't ask them to go to bed or down or anything like that, or even quiet. We just say thank you, so good, and then we toss cookies away from the noise and we let them snuffle that up off the floor. It sounds like it would increase the barking, but it actually doesn't, because our dogs are hardwired to bark at noises. They're gonna bark at noises. We bred them kind of for hundreds of years to bark at noises. And so if what we get is they alert and then they soothe themselves and they disengage and they eat and they calm down, that's good for me. If they're going back to bark again and again and again and again, we're looking more into that health area. We're looking into that exposure management area. Can we put more white noise machines up? Do we need to put baby gates up? What is it? We don't want to be in a position where we're just going thank you, thank you, thank you, thank you over and over again. If we are seeing that happening, we look to the other areas of the treatment plan to ascertain how we can break that cycle. But it's a great way to just start. If you've been in the habit of yelling at your dog like I was, or just kind of freezing up and not knowing what to do in the moment, not knowing whether you should or shouldn't feed them, you can always read more about the thank you protocol when I send out the resources. But just know that if your dog barks and you say thank you, and then you just throw a bunch of food on the floor for them and you just give them all their daily calories doing that, that's totally fine. You can then track and see if it works, see if the barking goes down, if they start to soothe themselves faster, etc. If they start to bark and then come to you for their cookie, you'll be able to see if it works or not if you're looking in the right areas. But yeah, thank you for barking. Hugely helpful protocol to practice. Scent work, getting our dogs sniffing, using their nose. Many dogs in chronic stress states do not breathe properly, kind of just like us. When I get stressed, I start breathing up here in my throat and in my chest. But when I'm calmer and feeling better, I breathe down into my belly and my abdomen. Our dogs, when they're sniffing, especially if they're doing that like kind of sniffing, it's kind of like doing breath work for us, and it has a similar effect on their physiology and their nervous system. So if we're having dogs in chronic stress states, teaching them regulation skills like scent work can be really helpful in managing their stress, in helping them come down after barking, and to stop them from going back over and over and over again to noises by building their ability to search for food. Super helpful skill. Confinement or safe space conditioning. For some dogs, especially dogs with medical issues, sometimes we just need them to be away, right? And teaching dogs to feel comfortable and enjoy being in a crate or a pen in the back of the house, so that you can have that game of Twister or do sparklers in the back garden or whatever it is that's going to scare them. If you can teach them to be comfortable confined, that can be a huge tool in managing their fear and anxiety for the rest of their life. So it's a huge part of a treatment plan is sometimes working on this, and it can take months to build comfort in safe spaces. We have 2 games that we have developed that are specifically for sound sensitive dogs. One is the Listen to That game, which is a game that counter conditions and desensitizes our dogs to sounds. So if you have a dog that's specifically sensitive to certain sounds, like dogs barking or the doorbell, we can work to reduce their sensitivity. And then the Smash game is a confidence building game that we have, especially useful for dogs who are a little bit phobic and generally fearful and underconfident. Flight and distance creating therapies, flight training, flight cues, teaching dogs to move away from scary things. I think of it like teaching boundaries. It's like you're teaching your dogs, when you feel uncomfortable, move away, say no, turn around, walk away, take a breath. This general concept is something that we teach in all of our programs, but you can apply it specifically to noises, and it can be really helpful teaching them to move away from noises and go to a specific spot to access some sniffing for food, for example. Body awareness. Often lots of our dogs who struggle with chronic anxiety are not particularly present in their bodies. They can struggle with lack of proprioception, body awareness, lack of introspection issues, lack of knowing where their body is in space, feeling them, how they're feeling internally. Can happen with chronic stress and anxiety, and we often see it with dogs who are maybe uncertain on their feet or slipping a lot, or just kind of a little bit shy about the way they move their bodies, or just very wild about the way they move their bodies and completely chaotic. Body awareness therapies, like physiotherapy exercises, muscle strengthening exercises, etc., can be really helpful integratively to help our sound sensitive dogs feel more comfortable, calmer, and also it can be a great way of building focus and presence around noises. So I often do body awareness exercises with my dog Hira around scary noises. Now that we're in the kind of advanced stages of our healing process, he will be doing like essentially yoga, doggy yoga, around noises that stress him out, and he's focusing on his body and his breath, and he's not hypervigilant to the noises. He's actually in his body and very present. So these are things that you might be adding into your toolkit, as well as adjusting activity schedules and just generally working on other anxiety triggers. You can get quite far with sound sensitivity without doing this, but at some point we have to also address the other underlying triggers. Are they scared of people, dogs, grooming, whatever it is? We might have to also address that down the line. That might be like stage 2 or 3 of the process, but down the line, if your dog is really scared of people entering the home, our end goal might be to build comfort with people coming in the home, expand their circle of friends, or similarly, but for, same, but with other behavior conditions that they might be experiencing. So you can see here, I've talked about, in terms of the healing process, the nature of that healing process. It's going to be very multimodal, and it's always going to start with breaking that stress cycle. So looking at managing their exposure, looking at anxiety medication, and then also looking at underlying health issues that might be at play here, and starting to think about that as an integral part of our treatment process. On top of that, we can then stack other therapies that are going to be uniquely tailored to your specific dog's needs. And if you work with us, we will kind of go through the ones that are most important to you, coach you through the process, break it all down for you, and make it easy for you to juggle all these different parts of the treatment plan. I'm finishing up and I'm going to take some questions, but just to give you some like final pieces of advice, we have, or final pieces of like information, we have a 4-week program for sound reactive dogs. It's called Sound Sensitivity. It takes you through this process in depth. There is pre-recorded material for you to watch, a bunch of really complex handouts, and then you do weekly calls. It's a group class, so it's a small group of people. You'll do weekly live Zoom calls for 1 hour for a month, where you work on training exercises together, set goals for the week, and then in between classes we have this online learning hub where you have like a kind of online classroom, and you can send videos and questions. So between classes you get to kind of progress and get help from your trainer intermittently throughout the week. So really excellent program if you're looking for help navigating what is actually quite a complex intersection of treatments that we are going to be implementing to see success in with dogs that struggle with this. And if you're not quite ready for that yet, you're just kind of in that learning process, which often takes place before we start moving forward and make that decision to move forward in our healing journey, I'm going to link for you all of the further learning materials that I've mentioned in today's talk in this page, so you can see some of the things that we've discussed today, as well as some new stuff. We have an Instagram guide. I've linked our full webinar library, so you'll be able to find everything that you need to continue your education for free here, and learn as much as you can without having to spend any money, because that's always great. All right, my loves, I'm finishing up. I'm going to answer a bunch of questions now. But if you don't already follow us at Canine Academy, you can see our website, and on our website there, you will also find the webinar library. And if you have any questions, you can just send them to info@calmcanineacademy.com, or just DM us on Instagram, because we're quite responsive there. So I think I'm going to spend a good 15-20 minutes or so answering some questions. So if you have any, pop them in the chat now. I'm going to swing back and go through the questions. Thank you so much, everybody, for saying thank you. I hope you enjoyed that little overview, a little like whistle stop tour of the way that we would kind of at CCA address treatment plans and healing plans for stuff like this. All right, I'm going to go right up to the beginning and have a little look here. So I've already talked about anxiety meds and ages. My dog is 7 months, and for the last few months, she's been anxious about noise and outside sensitivity. So you're saying for the last 5 months, she's been anxious about noises and sensitivities. So dogs that are under 6 months old exhibiting significant fear is actually quite unusual. And I say that as an expert in canine fear and anxiety. So if we're seeing significant fear from very, very young dogs, if we're not seeing default excited curiosity as their way of moving through the world, straight to the veterinarian and the veterinary behaviorist we go, because there's probably some sort of genetic component, potentially early trauma, and that will likely have to be treated medically as well as from a behavior perspective. The other thing I'm seeing is that your dog is 7 months old now. And when dogs hit, between 6 to 8 months, they move from puppyhood into adolescence. And that's often when I see a lot of clients coming to us struggling with sound sensitivity, because their dog is at this age where they are more likely to be sensitive to triggers, especially noises. I find, especially certain breeds, and especially if you're in the city, as we kind of mentioned before, these are all things that contribute. So if we're seeing dogs in adolescence who are really struggling, we can acknowledge that, 1, it makes sense that they're struggling, but 2, they shouldn't struggle without support. We don't want them to struggle. And I want to normalize adolescence being a challenging period, but I don't want to normalize adolescence experiencing maladaptive fear on a daily basis. Our dogs shouldn't be scared every day. And as someone who had a dog from a young age who was scared every day, my dog Kira came to me literally pooping himself when cars went past on the street. He was so scared, shaking, shutting down, unable to eat, urinating. This is not normal. I wish that when he was 6 months old, someone had said to me, take him to a psychiatrist. This is not normal, because it took me 4 years to get him the anxiety medication that he needed to start seeing the progress that he needed. And I wish that I had someone to counsel me and give me that perspective, because it's actually not normal. Someone's mentioning that they've scheduled an initial consultation with a vet behaviorist in Colorado, it looks like, which is amazing. And Amy mentioning that it's really challenging to get anxiety medication and behavior medication in Qatar for animals. And we work with people all over the world. We've worked with folks in over 15 countries. Amy, Qatar is one of those. But depending on where you are, it can be really, really challenging. And part of what we can do to help is just to provide a realistic look at your landscape, what's going on, what's realistic and what's not realistic. And that's often what we're looking at sometimes when we have dogs where we can't access medical care. It's a really, really challenging scenario for sure. Can these sensitivities linger after a known medical issue is resolved? Our mini poodle had PDA and had to get surgery at 3 months. She's 8 months old, but still exhibiting sensitivities. What a great question. I don't know what PDA is. Public displays of affection is what I know that term as, and I'm guessing that's not what it was. But in general, surgery, significant medical issues in early life, to me, that's trauma. That's early life trauma, because that dog in a formative, pivotal part of their life experienced significant physiological distress, discomfort, had to go into surgery, had to go through the recovery process. A lot of that could have been quite significant for that dog. And I also know that a lot of dogs' sound sensitivity can get worse after spay and neuter surgeries. We know that pain and discomfort impacts sound sensitivity, and we know that trigger stacking is going to impact sound sensitivity. So when we have dogs who are having medical trauma, essentially, especially at a really, really young age, all the red lights are flashing for me. And I wouldn't be surprised if that if the behavior change lasted even after they'd cleared up and healed from the surgery, because that's what trauma is, right? It sits in the body. Now, using these multimodal treatment frameworks, we can heal. It's possible, but it's good to acknowledge that sometimes things that we think are normal are actually traumatizing to our little creatures that we look after. And maybe that resonates with you a little bit, because I certainly had experiences as a child that were significant to me that no one noticed, because it was just normal. It's just normal sometimes for dogs to get sick and to go into surgery. But is it actually? Oh, thank you, Hera. What are you hearing, huh? Good job. Thanks, baby. Perfect example of the thank you protocol in use right now with my own dog, who just got surprised by someone coming in the front door, which is just down that stair. And he's laying down there in bed, eating his cookies, and he's just gone back to sleep. So one bark, thank you, and gave him a cookie. We were talking about something quite heavy, weren't we? Anyway, yes, this idea that we might actually, like, things that are quite normal for us and normalized for us might actually be traumatizing for them. And someone says, how do you even get a fearful adolescent into the vet without further trauma? Great question. And the answer is probably anxiety medication, to be perfectly honest. And a fear-free vet might also be a good option. Definitely look at the Managing Reactivity webinar, because that's going to be a really useful tool for you if we are looking just to generally manage stress and generally manage anxiety. Because if we can't manage the scenario, if something needs to happen, often medication is what we're looking for. Actually, Karishma, I'm going to recommend that you also look at the handling aggression or happy handling webinar that we have, which is all about veterinary care, medical care, etc. So that will deep dive into that as well. I'm like working on world domination with this webinar library, if you can't tell already. Ask your vet to come to the car. Many different options to minimize stress. But to be perfectly honest, if your dog is really fearful and phobic, we are often looking at all of these things, and then potentially also looking at situational anxiety medication in the moment to manage that stressful incident and to minimize the long-term effects of that stressful incident from staying in their body, from stacking in their body and causing increased sensitivity and having that stress cycle continued. A few folks here asking about medical exams, and we kind of touched upon it before, but I guess it's worth saying again. Often we have to go to multiple medical practitioners before we get the answers that we need. I can give you some examples. So one of the dogs we have in our house, she's called Emily. She is a rescue. She was a street dog in Romania for many years, and she was adopted and brought to London, and she now lives with us. We went to 5 vets who did physical examinations, etc., and said that she was fine. I was certain that something was wrong with her legs, certain. And it was the 6th vet who diagnosed correctly luxating patella in both knees, and then gave us a pain management pain management protocol, and we're doing physio now. And we saw, once we managed her physiological symptoms and her pain, 75% decrease in her sound sensitivity, pretty much 100% decrease in her hyperactivity, panting, wide eyes for no reason, or for like half an hour after a noise, she'd still be panting, you know, all of that went away. So sometimes the journey and the trial, the challenge is that resilience to keep trying, and sometimes having someone help guide you there can be really helpful, because, you know, people are mentioning thyroid tests, liver function, urine tests, gait analysis. There's so many different things. Every single bodily system is up for grabs. Basically, we're going to have to check it all and make sure that everything's in working order. So don't feel like you have nowhere to go if your vet has taken a look at the dog and said, oh, everything's fine. Maybe even 2 vets have and said everything's fine. Maybe you got some blood works back and they came back normal, or a scan that came back normal. That's just one thing that we looked at. Maybe we'll have to keep digging to find what is going on. So some questions about the thank you protocol here. Again, touched upon it briefly, but let's go into more depth now. Do you continue to do the thank you protocol if they continue barking? Or should I just look at the full thank you protocol? I mean, for sure, look at the full protocol, the thank you protocol by Kiki Yablon, and I'll send it to you all in the email. From my experience, if we're seeing dogs that are going back to bark again and again and again, just feeding them in that moment is not really going to be helpful. I will often, if they continue to go back, just move them away from the noise, put a door in between them and the noise, try to change the picture, leave the room for 5 minutes, come back in, something to like shake it up, because they can get stuck a little bit. And if that's happening regularly, then I'm thinking more integratively. Do we need to be putting up more white noise machines? Do we need to be working on crate training so that we can keep them away from the doors and windows for rest? Do we need to be going to the vet to talk about managing their anxiety? So we want to avoid having to say thank you over and over and over again, and not rely on that as the only thing we do. That is part of this multimodal framework, and it all holds each other up. So definitely thinking about that. Yeah, so someone's mentioning that sometimes they'd scatter the treats and the dog wouldn't respond. They'd just continue barking, and then maybe they'd come and get the food later. I would not consider that successful. I would be looking at ways that we could manipulate the situation so that they are not feeling so overwhelmed that they're not even able to eat. And again, looking at the base of the pyramid there, the health, the exposure management, that kind of stuff. Oh, great question from Max here. Would it work to recreate scenarios that trigger my dog, like knocking, etc., and then apply one of these in therapy? It can be hard to control a situation and focus on my dog. So when looking at like other sound sensitivity therapies, a few of these might involve recreating scenarios that are triggering in a sub-threshold way, meaning we might start to introduce triggering noises to your dog in a way where they are not barking. They are not even looking worried. They are chill. They are so chill. And we're going to be looking at the listen to that game. That's one of the ones that we use. It's a protocol that we've created. It's like a 3-4 part game, essentially, where we start to introduce triggering noises and decrease the dog's sensitivity to these triggering noises. However, if you just start knocking on stuff and treating your dog, or having your partner go into the hallway and thump around, and your dog's barking or rushing over to the noise and then rushing back at you or looking worried, you might be making it worse. If you are doing therapy with your dog to reduce sensitivity to a trigger and they look nervous, you are likely not doing it right. That is super important, because I did therapy with my dog for 4 years thinking that I was doing it right, and I was making it worse because I wasn't doing the right kind of therapy. I wasn't doing high enough quality therapy. Low-key, I've had that same experience with human therapy, right? If you don't have good therapy, bad therapy is bad, and bad therapy can do damage. So if you are going to be DIYing this, do it with caution. And just remember, if the dog looks like they're having anything but a really positive experience, we're not doing it right. The way that we have written and created the Listen to That game, it's created such that the dog is in control. The animal leads the therapy. And if you were to work with us, for example, in sound sensitivity or in a private program, we would take you through that protocol and walk you through the steps to make sure that we're doing it in a way that's going to be effective. And importantly, giving you the skills to do it so that you're not tethered to a trainer and a professional to do it for you. Someone's asking, is there a sliding scale option for the sound sensitivity course? We don't have a sliding scale option right now. We do have one free spot that we give away, and we offer payment plans as well. So those are kind of what we will usually offer. If anyone is really wanting extra help, do DM us. We might be able to do something like offer you a observer spot where you just watch the other, the kind of current participants do their training and kind of fly on the wall for their therapy, so that you could then do as much learning as you can without it putting extra stress on the trainer to the point that they're, you know, having too many clients that they have to keep track of. But that way we could potentially come up with something, and we have done that in the past, especially for like Black, Indigenous, people of color from our community. And if you need help, do reach out to us, because we always want to do our best, and we do offer some help, so come to us. And if not, payment plans are available. Ooh, I live somewhere rural. Can it be being very quiet contribute to hypervigilance? This is a great question. Ooh, nerdy question. Okay, so sometimes dogs can be very, very sensitive to what we call environmental change. So changes in the environment can be very triggering for them. If we have an extremely barren environment and suddenly a bird flies, that environmental change, that contrast, can be extremely alarming for some dogs, especially certain breeds, hunting breeds, guarding breeds, herding breeds, terriers, stuff like that. So definitely could be something that contributes to hypervigilance. And we've worked with many dogs for whom that's the case. But it's a really interesting point that sometimes actually a lack of stimulus can, and then that contrast can be the thing that's triggering for our dogs. Are there any examples of the Listen to That game, the Smash game, and any of the resources? No, to be honest, because I don't like giving out half of the equation, and I don't want people like trying to copy therapy that they see online. However, you can find some examples that are not really like tutorials, but more just like visual examples that are not intended to be like replicated. You can find them, some of them on our Instagram, so you have a little look and you might be able to see some of them there. Maybe I'll do some live training with Hira at some point, and I have done Listen to That live at some point on the Instagram as well. Good question, and 2 people have like boosted this. Is teaching barking on cue ever a good idea? You know what? I think it depends on the function of your dog's behavior. If we have dogs that are barking not because they're scared, but because they really like to alert their guardian, or they enjoy barking, it's fun. That's a thing. Some dogs that were bred to be guard dogs, if they're not fearful, they might just be barking because it's like genetically within them and it feels good for them to bark. In these cases, it can be useful to develop control. We call it stimulus control around that behavior, teaching them an on and an off cue. However, with dogs who are having fear responses, it's not really that they're not able to meet their need to bark, and that's why they're barking. It's not that the barking feels really good and that's why they're doing it. I mean, maybe that's part of it, but a lot of it's fueled by this fear. I want to feel safe. I want this thing to go away. I want control over my environment. So teaching barking on cue is not really going to help if your dog's having a panic attack. They're likely not even going to be able to respond, because it's actually the emotion that's the problem, not the behavior. And this idea that I see lots of trainers putting around the internet, that when we have dogs that are sound sensitive, we need to teach them a quiet cue and a barking cue. It's kind of like if someone has a panic disorder and you're like, we're going to teach you a panic cue and a calm cue. And when we say panic, you're going to panic. And when we say calm, you're going to calm down. That's not really how emotions work. And it feeds into this idea that we can heal anxiety through obedience. We can't heal anxiety through obedience. Anxiety is healed integratively by meeting the needs, the underlying needs, not by controlling the behavior like a robot, like on and off button. Can it be useful in some cases? Absolutely. The majority of cases I see where dogs are barking from fear, obedience is the last thing on my list. We're looking at loads of other things before that. It's a great question from everyone. Oh, yeah, I'm glad it was helpful. Can you say more about window film? Yeah, window film is just this like sticky film that you can put up on the windows, and it just makes it so that you can't see through it, but the light still comes in. It's easy to peel on and off, and it costs like $10 on Amazon. Just put it in Amazon search and you'll find it. So it's really good if you're renting, and it can be really helpful for dogs that stare out the window. Often sound sensitivity can be accompanied with that vigilance, right? So if we want to, we might be putting up some window film. Yes, you will receive the slides via email. And if you're watching the recording in our webinar library, you can find the slides linked underneath. Great questions. We've got some folks talking about how when they've moved home and that's triggered a kind of resensitization from their dogs. And for me, when we're working with sensitive dogs with big feelings, there's never going to be like an end point, like my dog is finished healing. Just like if you're working with sensitive humans, it's kind of like a management process, and it can become so seamless that it's easy and it doesn't feel like a chore. But the important thing is that you understand, and you as the guardian have the tools, because Amy's saying here that you moved to a new home and suddenly we've seen a re-emergence of the sound sensitivity. Well, that makes sense. All the more reason for you to be empowered with the skills and knowledge you need, rather than being kind of tethered to a trainer to help you every single time. And knowing that throughout your dog's life, you'll see fluctuations in their sound sensitivity, and just riding that wave, knowing that you know what to do and that you can you can heal, you can support them through this. That's kind of the thing that I kind of push on folks as a really important thing, is that you're going to be working on this for a long time. So enjoy the process, and know that for me, 6 years in now, it's like it's kind of easy. Like it just feels natural. Like I manage my own stress, when I'm feeling a little bit angsty, go to the gym, or do some yoga, or go for a walk, or have a rest and watch some shitty TV. I manage my own stress, and you become almost like intuitively, you start to manage your dog's stress as well, when you get to really understand this stuff. Oh, great question about anxiety meds and whether they can be temporary. Absolutely, they can be temporary, 100%. And again, all discussed with a veterinarian, all done alongside a veterinarian. But in many cases, especially I find if we're giving meds at a young age, sometimes we can wean them off, or like titrate down, or just like generally reduce how much we're giving them over a long period of time. But we're talking about years often, not months. Just to give you an idea of like set some expectations there. Ooh, lots and lots and lots of questions. Oh, someone's mentioned that the dog might have had a trauma experience, but when they were being harassed by a stalker. Now, this is not unusual. If humans experience trauma, especially around the home, and it's noise related, like break-ins, etc., or something like this, which I'm very sorry you experienced that, we can see dogs becoming really sensitive. And will moving fix this? Difficult to say, impossible to say without knowing your dog. But I'd be looking at how generally resilient your dog is to see whether or not I would predict. But you would never know. You never know. All right, I'm going to answer a few more. We'll finish in 5 minutes, I think. Yeah, someone's talking about the fact that their dog doesn't bark. They just have this freeze response. And that's part of the fight, flight, freeze response. We might see barking, we might see biting at the leash, we might see freezing, we might see running away, we might see them just like becoming really goofy and like clowning about in like a kind of crazy way. All of this is part of that panic response. So it might not just be barking, you know, it might be other responses as well. Someone's talking about food allergies causing continuous diarrhea. Could that be affecting her noise sensitivity? 100%. Yes, I should have mentioned that specifically when we were talking about medical issues and health complications. But GI issues and GI discomfort is a huge system that affects mental health and wellness and anxiety. So if we have dogs with persistent GI issues and chronic anxiety, we often have like a chicken and egg scenario that we're dealing with, and dealing with the GI issues will be a huge part of the healing work to get this dog feeling more comfortable with noises. And I'm imagining that when we see those GI symptoms decrease, we'll see the sound sensitivity symptoms decrease as well. Oh, someone's talking here about sound sensitivity outside. So how do you manage a panic situation when the dog is triggered and so over threshold that they start running no matter what? This happened to me and Hira a lot when we lived in New York. Like you're mentioning a fire truck stopping close by and blasting the horn. These are things that happen in the city quite frequently, and it can be so overwhelming for our sensitive dogs. If this is something that's happening frequently, again, think about integrative stress management, proactive, not reactive stress management, and medication to support them, because that is really challenging. But often in those panic situations, I try to just move away as much as possible. If I can't move away, I just hunker down and wait and comfort them as much as I can until the sound's gone. And then usually I just take them home. If they were that scared, they probably shouldn't be walking around the city after that, you know. That's going to be, they're already going to be all stressed. And I've been in that situation many times with Hira, where I was stuck on the street with him and panicking. However, like if we're in that situation, I am going to be considering, do we need to be walking this dog as much? Can we minimize walks, adjust walks to avoid this? And I would definitely check out the Managing Reactivity webinar, because even if it seems impossible, you'll be amazed at the kind of creative solutions we can come up with. I worked in New York for 4 years in Manhattan, and I worked with very sensitive dogs. So we've got good at coming up with strategies that will manage their anxiety. All right, I'm going to do one last question, and this has been bumped by a few people. So any tips for dogs that pick up on their owner's anxiety? Ooh, what a good question. Okay, so first of all, there are lots of trainers, especially on the internet, who go around telling guardians that they caused their dog's anxiety because they're too anxious. And if you're like a type A sensitive babe, like myself, that can really not be helpful advice, because it can really put a lot of pressure on us. But it's not only unhelpful, it's also just kind of garbage. Sorry, I have feelings about this, because I think blaming guardians for being anxious and causing their dog's anxiety is not very helpful. Likely your dogs will be anxious even if you're not anxious. Just let's say that. However, if you are visibly stressed, your dogs can sometimes, that can add stress to them on top of other triggers. And also, if you're very stressed, you might not be able to make the best decisions in the moment for your dog. So I'm really thinking about it more from that angle, that I want you to be able to make the best decisions in the moment and not be paralyzed by stress yourself. When working with us, we work on a few different exercises with our guardians, breathing exercises, grounding exercises. Sometimes we send our guardians out on walks without their dogs to observe triggers and work on their own reactions without the dogs present. And often, to be perfectly honest, just having a solid plan and knowing exactly what you're meant to do in any moment is going to be the thing that has helped alleviate my anxiety the most, because for me, it's not knowing what to do in that moment that causes me the most anxiety. I think not knowing what to do, and then that physiological stress response that we might have when they experience stress. So have a plan, and then work on your own regulation skills so that we can breathe through their reactions and calm our hearts down and slow our breaths. And when my dogs do react at sounds, thank you. Oh, it's very scary, isn't it? Yeah, you're a very big dog. Should we walk away? All right, come on, let's go. Good job. You're such a smart dog. And I'm trying my best with my voice, like breathy, calm. I treat them like kids. They're little, like that. They're little kids. Like, you just treat them like little kids, or like your inner child. You know how I speak to myself sometimes if I'm feeling like I need a little extra help. And I try to make content about that stuff. People are saying that you like the examples. I try to make examples because it helps to have that script in your head, so you know what to do and you don't have to make so many decisions in the moment when you're already dysregulated. But I love that question. So any tips for dogs that pick up on their owner's anxiety? One, don't blame yourself and don't let anyone tell you that it's your fault. However, you can work on regulating your own nervous system and nervous system regulation skills, breathing exercises, tapping, visual observation exercises, whatever works for you. And then you can regulate yourself so that you can enact the plan that you have. And if you need a plan, that's what we're here for. Reach out to us, DM us, email us. We can help, and we can give you stepping stones that you need to get from where you are now to where you want to be with your dog, so that you can have a slightly more peaceful life and peaceful coexistence with them. Whew, folks, we nailed it. That was like an hour and a half. Thank you so much for staying the whole way to the end. You've all been amazing. Almost everyone stayed, which never happens. So I'm really grateful to everyone. I'm going to be sending out the slides and the recording. You're going to get links to everything that I've chatted about. It should be really, really easy, and it's going to be in your inbox tomorrow. If you're watching the recording in our webinar library, you can find everything linked below. And if you are looking to do some more learning over the next month, we have 2 more webinars this month. Next week, we have the Healing Sensitive Dogs webinar, which is where we deep dive into the CCA framework, the HEAL framework that we mentioned in this webinar for behavior change and wellness. So we're really it's the first time that we're kind of displaying this framework to the world. We're very proud of it. So you can join us next week. Tickets will actually be $10 for that, because it's our secret sauce. It's our magic sauce. So you're not going to have to cough up for that. But we have another free event at the end of the month, which is a free virtual tricks workshop with myself. We're going to be doing trick training, and it's going to be functional trick training for sensitive reactive dogs. So it should be really, really fun. And it gives you an opportunity to practice and see what it would be like to take an online class with us, because online dog training is a bit weird, but it's actually really fucking cool. And I hope to see some of you there. If you want to join us, you can sign up through the links in our bio, and I'll send you links tomorrow in the email. All right, my loves, thank you so much for watching. Enjoy the extra content that you'll be hopefully perusing off the back of this, and I'll see you all over the internet, probably around the internet. Thank you for being awesome guardians and awesome supporters of our work, and I'll see you soon.